The virus gripping those working inside one of America's hospitals is it's just crazy now. New today, the Cleveland Clinic reports 970 caregivers are out due to COVID. Think of that. Triple the number from just 2 weeks ago. The hospital, of course, in a region where cases are on the rise. On the left, you see the daily cases have jumped since September. On the right, same for hospitalizations, adding about 35 patients every day. Kelly Hancock is with us now. She's the Cleveland Clinic's chief caregiver officer. Thank you so much for being here. Thinking through this, I'm like, if the Cleveland Clinic, it's the Cleveland Clinic, and they've got 960 people they can't keep safe to treat patients. I don't know what's coming for the rest of us.
Well, you're absolutely right. Good evening, and thanks for having us. So as we've seen the increased number of cases rise in the state of Ohio, we had a record today. We saw nearly 12,000 new cases in the state of Ohio of COVID-positive patients. And so when you think about the increase in the hospitalizations that results in, it's incredible. And as you mentioned, we're experiencing close to 1,000 of our caregivers who've been affected by COVID-19 and unable to come in and care for those patients. Luckily for us, in Northeast Ohio, we have a large health system here, and we have adequate bed capacity. But we really need to ensure that our caregivers, are able to come into work so we can care for those patients who do have COVID-19, as well as our other patients who have other clinical conditions.
Sure. Are you reaching a point where doctors and nurses are sick at such numbers that it's going to be difficult to give the care that people at Cleveland Clinic are used to getting?
Right now, we have adequate staffing. We're able to really mobilize our caregivers to the areas where they're needed most. But we continue to meet frequently throughout the day to continue to assess the situation for both of our caregivers as well as the bed capacity.
Yeah, I see your numbers, and we remind ourselves every day, these aren't numbers. These are human beings who are suffering mightily, and there are more than 1,000 human beings in intensive care in your state alone for the first time for this pandemic. It's one thing if we're able to get it under control and bring the numbers down. Kelly, that's not happening. The numbers are going up. And in a position like yours, I just wonder how concerned you are, not about tomorrow, but, a couple of weeks after Thanksgiving, where in the world we're going to be.
Well, we're deeply concerned about the rising cases, and particularly for our caregivers. The power is really with all of us right now. As members of our community, we could really take this into control. We have to listen to our public health officials. We have to ensure that we adhere to the safety measures, wearing our mask. We know that wearing a mask helps slow the spread of the disease, and wearing it appropriately over your nose and over your mouth. The social distancing is important, making sure that we don't, particularly with the holidays coming up, go to large gatherings, and of course, frequent hand washing. All of this is really concerning for all of us, and we need to do all of this to ensure that we can keep our caregivers at work.
Kelly Hancock from Cleveland Clinic, all the best to you and all of our heroes there and in hospitals across the country. Thank you. Shepard Smith here. Thanks for watching CNBC on YouTube.